Hello and welcome. Today, we're delving into a condition affecting the oral cavity, oral leukoplakia. We'll explore what it is, what causes it, how it's diagnosed, and what can be done about it. So, what exactly causes oral leukoplakia? While the precise cause is often multifactorial, the most significant culprit is chronic irritation. Tobacco use, whether smoking or chewing, is a major contributor. Excessive alcohol consumption, ill-fitting dentures, and rough teeth can also irritate the oral mucosa, increasing the risk of developing leukoplakia. In some cases, human papillomavirus, or HPV infection, may be associated with certain types of leukoplakia. Let's talk about how oral leukoplakia develops. Continuous irritation causes the cells of the oral mucosa, the lining of the mouth, to undergo abnormal changes. These changes are called epithelial dysplasia. The cells start producing excess keratin, a protein that makes the affected area appear thick and white. This process is called hyperkeratosis, which is the hallmark of leukoplakia. Over time, these changes can potentially lead to cancerous transformation, especially if the irritation persists or worsens. Oral leukoplakia is not uncommon. Its prevalence varies depending on geographical location and lifestyle factors. It's more frequently observed in individuals who use tobacco and alcohol. The risk increases with age, and men are generally more affected than women. Accurate prevalence data can be challenging to obtain due to variations in diagnostic criteria and population studies. What are the signs and symptoms of oral leukoplakia? The primary sign is a white or grayish, white patch or plaque that develops on the inside of the cheeks, gums, tongue, or the floor of the mouth. These patches are typically flat or slightly raised and have a hardened surface. They can't be scraped off, which distinguishes them from conditions like oral thrush. While often painless, some individuals may experience sensitivity to spicy or acidic foods, or a rough feeling in the mouth. Diagnosing oral leukoplakia involves a thorough clinical examination by a dentist or oral surgeon. The professional will carefully assess the location, size, and appearance of the lesion. Importantly, because leukoplakia can, in some instances, turn into cancer, a biopsy is usually performed. A small tissue sample is taken from the affected area and examined under a microscope to determine the degree of dysplasia and rule out cancer. While not strictly types in the same way as cancers are classified, oral leukoplakia can be categorized based on its appearance and risk of malignant transformation. Homogeneous leukoplakia presents as a uniformly white flat or slightly raised patch. Non-homogeneous leukoplakia, also sometimes called speckled leukoplakia, has a mixed white and red appearance or an irregular surface and carries a higher risk of becoming cancerous. A type with very high risk is proliferative verrucous leukoplakia, PVL. PVL is a progressive, high-risk form of leukoplakia that spreads slowly and has a high rate of cancerous transformation. The primary goal of treatment and management is to eliminate the source of irritation and prevent cancerous transformation. This often involves stopping tobacco and alcohol use. The white patch itself can be removed through surgical excision, laser ablation, or cryotherapy. The choice of treatment depends on the size, location, and severity of the lesion, as well as the patient's overall health. Regular follow-up appointments are crucial to monitor for any recurrence or signs of malignant changes. Preventing oral leukoplakia largely revolves around eliminating risk factors. Quitting tobacco use and moderating alcohol consumption are paramount. Maintaining good oral hygiene, addressing any ill-fitting dentures or rough teeth, and undergoing regular dental check-ups can also significantly reduce the risk. The prognosis for oral leukoplakia is generally good, especially when diagnosed early and treated promptly. However, the risk of malignant transformation or developing into oral cancer remains a concern. This risk varies depending on factors such as the type of leukoplakia, the degree of dysplasia, and the individual's lifestyle habits. Recent research has focused on identifying biomarkers that can predict the likelihood of cancerous transformation and on developing more targeted therapies to prevent this progression. Studies are also exploring the role of HPV in leukoplakia development and its implications for treatment.